Hi everybody, I'm Dr. Amy Kanata, and today we're going to talk about post-op hip rehabilitation exercises for weeks 4 through 8. Today I'm joined with Ashley Bratko. She's got quite a bit of experience, years of experience working with patients with post-operative total hip replacement. So welcome, Ashley.
Thank you. The goals week 4 through 8 is going to be mostly on your stretching. We want to make sure that we're really keeping those muscles loosened around the hip joint, and a little bit with the strengthening. You're going to do some light strengthening, and again, something to think about is that if you're having pain with that strengthening stuff, you can back down on that, but the stretching is really going to be important during those first few weeks.
Right, and before doing any of these exercises, please make sure to check with your surgeon to make sure that the exercises that we're showing you today are safe for you after your surgery. We're going to keep everything really basic that could apply to most people after their hip surgery. We're just going to keep things really simple. So first thing we want to focus on or talk about is something called manual therapy.
So manual therapy is going to be when a therapist goes in and kind of deep tissue massages, and only using the word massage, but they go in and work out those muscles, the knots that you have going on with their hands. They're also going to work on some strengthening, hands-on strengthening and hands-on stretching with you. And they might also use some other techniques that they are certified in, as well as things that your surgeon might require.
The purpose of manual therapy is to make sure that the scar tissue doesn't form so that you get the maximum range of motion out of your brand new hip. Alright, so we're ready to start the exercises. The first thing that you're going to need for these exercises is a towel and a pillowcase. So grab your favorite pillowcase. So today we're going to be demonstrating with you the top 5 kind of basic hip replacement exercises that you can do post-total hip replacement. One of the things that we see with patients predominantly when in terms of hip replacement is a couple things. The hip muscles right in the front, they're called the hip flexors, they tend to be very tight on people. The second thing that happens too is that the gluteus medius muscle, which is the muscle, sounds like a big long word, but it's the muscle that allows us to raise our leg and raise our leg to the side. The other muscle that gets deeply deconditioned in a lot of people are the glute max muscle. So that's the first muscle we're going to focus on. That is primary to hip stabilization and great core and really get the most out of your brand new hip. So the first exercise we're going to do is really simple. You're not going to be able to see Ashley doing anything, because what it is you're going to contract your glutes as hard as you can for the count of 10. You're going to hold it for the count of 10. You're going to relax, and that's it. That's one repetition. So that cycle, contraction for 10, relaxing for 10, that's one repetition, and you're going to want to do that 10 times. The next exercise that we are going to show you is an exercise that is very, very basic called hip slides. So you're going to need to position the pillowcase underneath your heel, the heel bone, and you're going to want to grab your towel if you can, and you're going to want to bend that knee, bend the opposite knee, and you're going to want to, keeping your heel on the table, slowly bring that heel towards your butt, and then slide it on back. Now let's just say that you're not able to sit and do this just quite yet because you're in too much pain. This can actually also be done with you laying down. You just won't have the advantage of the towel. All you're going to do is go ahead and slide your heel back towards your butt, keeping your heel on the ground. And then just going to slide it as far as you can and back. Slide it and back. So this can be done 2 ways, one with the towel, one without the towel, which kind of leads us into our next exercise, which is one of the things we talked about. We talked about the glute medius muscle. It helps us raise our leg. So if you're not able to do this standing up just quite yet, you can also do this laying down. So Ashley's going to demonstrate, all you're going to do is you're going to use your pillowcase. You're going to go ahead and slide your heel off to the side. You're going to want to keep your toe pointed up towards the ceiling. That helps to actively engage that glute medius muscle. Great job, Ashley. going to be doing some straight leg raises. Now this one you might actually need a partner for. We're going to take our pillowcase and our towel. Actually, go ahead and raise your leg up. And go ahead and lower it down. Now this helps to activate the muscles in the front of the leg and really gets them stronger. So you're going to want to try to do this 10 times. Good. Now let's just say you can't quite get it. Go as far as you can without pain. So we want to keep your pain around a 5 to 6 at the most when you're doing these exercises. So let's say you get to here and that's all of the strength you have. That's okay, don't worry. Let's say you get tired at the top, you can just tell your partner, hey, I'm tired, and your partner, go ahead and relax. Your partner can lower your leg down for you. It's best to try to do as much as you can for yourself and really kind of push yourself without pushing yourself past the point of pain. All right, so the last exercise we're going to show you today is to really strengthen that glute muscle and make sure that you get the maximum extension out of that brand new hip. One of the most important things with this exercise is making sure that as you're doing it, you're not getting a lot of extension in your spine. That's the arch in your back. That'll put a lot of pressure on your spine, and that's not what we want. So it's a very small range of motion. We're going to demonstrate it's just a super small range of motion. It's just designed to activate the gluteal muscle and get some extension back in that hip. Today we're going to be using the walker to demonstrate and to help Ashley stay stable. You don't need to use a walker. If you're already past the walker stage, that's awesome. Don't feel like you have to use the walker. You can use your kitchen sink or you can lean on the front. You want to just keep your back nice and flat. Back nice and flat. It's just a super small, you want to just do a super small range of motion. So this is what you don't want to do. You don't want to arch your back and put a lot of stress and strain on that back, kind of like hiking that hip back up behind you. Just a very small range of motion, keeping your back nice and still, nice and flat, keeping that range of motion nice and small. Great job, Ashley. We hope you enjoyed these videos. If you want more information, please go to hipreplacement.info and look out for more videos to come.